Jen calling in from Baton Rouge, Louisiana.
Yep, and then I am calling in from Seattle, Washington. Yeah, welcome everyone. It's so exciting to see so many people from around the world.
That's great. Well, I suppose we should get started. I want to welcome you all to today's webinar on effective patient-provider communication. I'm Shannon Lambert. I'm the Vice President and Regional Director for the Americas and Europe at Smile Train. And I'm pleased to introduce today our presenter, Cindy Ola, PhD in clinical child psychologist at the Seattle Children's Hospital, which also happens to be a Smile Train US Cleft team partner. And Dr. Ola is also faculty at the University of Washington in the Department of Psychiatry and Behavioral Sciences at the University of Washington. She received her PhD there as well in school psychology and completed her psychology residency program at the University of New Mexico's Health Sciences Center and her postdoctoral fellowship at Seattle Children's Hospital. Currently, her position includes roles in Seattle Children's Early Childhood Clinic, where they see patients ages 0 to 5 years, in addition to working in the Craniofacial Center. Dr. Ola has collaborated as a researcher and clinician on several projects related to the neurodevelopmental assessment of infants and young children with craniofacial conditions. And her publications have highlighted early predictors for developmental delay associated with school-age neurodevelopment in children with plagiocephaly, as well as qualitative analysis on the early literacy experiences and engagement of Latinx parents with young children with a cleft. So thank you so much for being here, Dr. Ola.
Thank you.
In addition to Dr. Ola, I also wanted to recognize and say many thanks to my colleague, Olga Kudamanova. She's a program manager for us over in Europe, so it's very late for her this evening. So thank you so much, Olga, for helping behind the scenes with the logistics of this webinar. Today's webinar will go over the benefits of effective patient-provider communication and how it can improve medical treatment results, as well as patient and provider satisfaction and overall experience of treatment for cleft patients and their families. Dr. Ola will share evidence-based strategies as well as practical recommendations for how you can incorporate this approach into your daily practice. The session will run approximately 45 minutes, and hopefully we'll have some time at the end for a Q&A. So please, throughout the presentation, feel free to enter any of your questions or comments into the Q&A little box down at the bottom of your screen. And at the end, we'll address as many questions as we can. And at this point, I think I'll turn the floor over to you, Dr. Ola.
Yes, thank you so much. That was a very lovely introduction, and welcome everyone. I'm very excited to have this opportunity to share with you all today this presentation on effective patient-provider communication. This is a topic that's really important to me, and I think about it often actually in my work with patients. And I consider it to be important in my work and also just personal relationships, right? I think all of us are working to be better communicators, because when we can do that, we can inform patients, we can strengthen relationships, which, as we'll learn as part of this presentation, there are also positive effects on patient care outcomes as well. So I wanted to start first with some of my favorite quotes about communication, and I'm highlighting these 3 quotes because when I reflect on moments when I haven't always been the most effective communicator, either with patients or in other relationship contexts, I end up catching my thoughts, and I realize that oftentimes they fall into one of these 3 buckets, right? So one of the quotes here says, most people do not listen with the intent to understand, they listen with the intent to reply. And I remember when I was finishing up my training, or really early on in my training as a psychologist, I realized that I often was worried about catching what families were saying so that I could really respond to their questions, right? And it highlights this quote exactly in that the listening really needs to be around trying to understand and not necessarily trying to reply to what families are saying. Similarly, with the second quote, is, to effectively communicate, we must realize that we are all different in the way we perceive the world, and use this understanding as a guide to our communication with others. And I think this one is really important, especially as we think about working with families from diverse backgrounds, from different cultural backgrounds. They've often seen the world in a different view, in a different light, and that often will impact how they perceive situations, what they're thinking about in your interactions with them. And so these two things, again, highlight the importance of communication and how it could be very different across different families that you work with. And then the last quote around communication works for those who work at it. I think I wanted to highlight this more so just to show that communication is something that we need to continuously work at. It's not something that we'll just be good at and that's it. It's a process. It's a learning process, one that I continue to learn in as well. So this is the agenda for my talk today. I'm hoping that I could cover some research on patient-provider communication. We'll talk about the benefits of effective communication on patient care and patient health outcomes. We'll also talk about communication and the cultural considerations that will be important to keep in mind as you're interacting and working with different patients. And then lastly, we'll talk about the communication strategies that you can use and implement in your practice. And we'll watch a role play of a physician who's implementing some of these strategies so that you can see them in action. So in medicine, patient-provider communication really has three main goals, right? So one is we're communicating with patients to create a good relationship. We're also doing that to facilitate and exchange information around the patient's care. And then we're also including patients in decision-making, right? And so throughout these different goals and processes, it's really important to be able to communicate effectively so that we can help patients make informed decisions, but also understand really the ins and outs of their care. And so it's for that reason that patient communication is so important. And I wanted to highlight this quote from an article that I read as I was doing, some of the research for this talk, because I think it really highlights the importance of patient-provider communication. And that is that it's really the central focus of medicine, really, and it's a central key player in having good provider-patient communication that's really going to inform the patient's care. So I have a video that I wanted to show that really highlights also some of the science of why this is so important, and then we'll dive more into some of the research before we discuss effective communication strategies. So I'm going to go ahead and play this video for you.
As an aspiring clinician, you entered medicine with a desire to help and heal. You made an oath to do no harm. However, in the rapid pace of healthcare today, you're faced with increasing demands, large patient loads, staff shortages, electronic health records, new technologies, mergers, and changing organizational structures, safety aims, and more. It's easy to lose sight of your purpose. When it comes to truly serving the needs of patients, you strive to ensure safe practices, to reduce complaints, and to enhance experiences for your patients and their families. Communication is key. Patients report communication and relationships with clinicians as the most important factor in high-quality care, even above accurate diagnosis and competence. They want a clinician who listens, is attentive, or shows interest in them. We worry that better communication requires precious time that we don't have. Fortunately, studies show that clinicians who express empathy actually save time in their clinical encounters. Additionally, patients experience better health outcomes, including reduced readmissions, better adherence, and they report less pain. Communication is the #1 driver impacting patient loyalty and patient experiences. We cannot ignore the critical importance of communication. Recent reports indicate that poor communication was documented as the cause of 1,700 deaths, $1.7 billion in hospital costs, and 30% of the malpractice claims filed over a 4-year study period. As a devoted healthcare professional, you strive to provide excellent care and to reduce the suffering of your patients. Most clinicians never receive training in communication skills. There's no quick fix. However, the good news is that clinicians can adopt advanced skills for building relationships, listening, explaining, and expressing authentic concern for patients. With deliberate practice and feedback, clinicians can dramatically enhance the quality of their encounters, which has been proven to enhance their own professional satisfaction and to decrease their burnout. For more support, contact the Academy of Communication in Healthcare, www.achonline.org.
There we go. So I wanted to show this video because I think it does a nice job of highlighting some of the science that we'll talk about in the next slide and dive in a little deeper into. But first, I want to hear some reactions from people in the audience. If you have a chance to, jot some thoughts down in the chat box. What was the most surprising to you in that video? I think for me, one of the things that was quite surprising when I first watched that was really seeing the bar graph that was depicted in the video, showing that patients really, what they want in patient care is providers who are more empathetic and understanding and better communicators, and that was actually more important to them than other skills like, getting an accurate diagnosis or something like that. And so that was, I think, a little surprising to me. And if you have some thoughts, feel free to jot them in the chat box. Happy to see what you guys thought about that video. So what I wanted to highlight next was just more on the research on the positive effects of good patient-provider communication. And what does the research say about doctors' self-reports on their own communication? And what we really see in the research is that overall, providers tend to overestimate their abilities in terms of how they communicate with patients. So there was a study that was done where they asked surgeons to self-report on their encounters with patients and really rate their level of satisfaction with how they communicated with patients. And about 75% of surgeons who were surveyed reported that they felt like they had satisfactory communication with the patients they had seen that day. And then in the study, they also surveyed the patients, and the number was quite different. Only 21% of patients reported experiencing satisfactory communication in their interactions with the surgeons. And so from what this study really concluded was that there is an imbalance, or there's not a clear consensus between the communicator and the person that's receiving the communication in terms of how clear or satisfactory that interaction is. And overall, patient surveys consistently show that patients really want better communications with their doctors and providers. And like the video mentioned earlier, there are many benefits to effective communication. So for example, we see that there's greater adherence to treatment regimens when there is more effective communication. We also see that patient reports of their overall health is also better. We see that there's also reduced pain and symptom resolution and improved symptom resolution in patients with providers who can communicate more effectively. We also see fewer side effects from medications. We also see that patients are more likely to be satisfied with their care. They're also more likely to share pertinent information for diagnoses, which is pretty important, right? As a provider, when you're trying to gather information about what's going on, patients are more likely to disclose. We also see that patients have more positive beliefs about their control over a disease or symptoms that they're experiencing. And then lastly, they also have more positive beliefs about their current and also their future health. And so all of these benefits, when I kind of take a moment to look them over and just pause, I really realized that effective communication has a really great impact on overall patient health. So why wouldn't we want to dive into this a little bit deeper, right? But there are also benefits to providers as well from having improved communication. So the research also shows that they benefit. So for example, doctors have better satisfaction, better job satisfaction. They also experience less work-related stress, less burnout, and they actually are more satisfied with, or satisfied patients are less likely to file formal complaints or initial malpractice complaints against doctors or providers, right? So this is something that in the video they were discussing as well, that there's like a 17 times more likely to have these complaints filed against them when communication or empathy is missing in that patient-provider communication. So I think from looking at this, we can clearly see that one of the main conclusions is that good communication is important, right? So what do we do? And we'll talk a little bit more about this in terms of the concrete strategies that the research has shown tends to make the most benefit for patients, and which of those communication skills patients are identifying as the most important to them, and then what does that look like? First, I kind of want to put out a pop quiz for you all to think about. So this question is, what factors are associated with better communication between patient and provider? And I'm curious to hear as the audience, what do you think? Do you think it's A, greater patient participation? And feel free to type it in the chat box, I should say that. Do you think it's B, shared decision making? C, treatment satisfaction? D, trust in the doctor? Or E, all of the above? So I'll give you a moment to submit your responses so we can see what you all are thinking in terms of that. And the answer is all of the above. E is all of the above. Each of these skills that are outlined here and tend to be one of the most highly rated skills that patients are reporting as being the most important. So we'll talk about each of these and its associated positive effects. So here I'm going to outline some of these key elements that we saw in the previous question. So patients are really noting that when they're encouraged to ask a wide range of questions about their problems, they do feel like there's more communication between the provider. They feel like they're being listened to, like what they have to say is important. They also report that asking about feelings and concerns, so when the provider is asking them about their concerns as they're coming into the office, that is also an important communication skill. Also, when the provider asks and also tries to understand the patient's perception of the problem and how it's affecting their functioning, it's an important communication skill. We also want patients to be active participants in care, right? And so when patients feel that they're participating in the shared decision making, those things are key. They also want to feel like they can express an understanding of the problem, right? So they want to be able to hear this from the provider. And then that problems have been discussed fully, right? So that the patient feels listened to and that they were able to share all of their concerns. So it's not only what providers do, but it's also the connection that patients experience with their provider. So an emotional connection around an experience is often fostered through empathy. And so that's kind of, and the last bullet point here is that when you're also communicating with patients, it's important to be able to combine the verbal information that you're providing with emotional support, and also, if possible, pairing it with written material. But going back to that emotional support and that key emotional connection, really we're fostering that through empathy, and there is a host of research that has been done around empathy, and they have found that that's really the base of good patient-provider communication. And in fact, when they've done surveys of patients, the qualities that patients identify as one of the key things that they would consider before recommending a doctor is empathy. So 80% of patients would recommend an empathic doctor to someone else. And like with effective communication, we see that patients experience great benefit and from feeling like their providers were empathic. So for example, there is improved patient satisfaction and adherence, there's lower levels of patient anxiety, patients are more likely to disclose information, and when patients disclose more information, we also get more accurate information about diagnoses. And then when providers show empathy in the relationship, it is also associated with more trust. It promotes more sharing, leading to better communication. And then you're also able to get more information about the patient's needs and treatments. They also feel more confident about their ability to help themselves, right? So building more self-agency. So there are so many benefits. And one of the things that I recently read in research that looked at empathy and patient outcomes specifically, so looking at blood work and changes in the actual patient's health, there was a study that was reported on patients with diabetes, and what they found is that those patients who reported having a doctor that was more empathic or had was showing more empathy, they actually saw more improvement in their blood work. So they did blood work on hemoglobin, and I think it was like another type of protein in the blood. And they actually saw better blood work in these patients than other patients who reported not having empathic doctors. And similarly, there was improvement in a different study where they were looking at patients with a common cold. And what they found is that patients who had the common cold who reported having an empathic doctor, they actually had colds that lasted on average 3 days less than those with less empathic doctors, right? So I think in the group of patients who had the cold and they reported having doctors who were more empathic, on average their colds lasted 5 days. And then those with a cold but who had less empathic doctors, as they reported, were having a cold from 7 to 8 days. So again, some of the science is reporting some good outcomes, right? So important to continuously think about communication as we're interacting with patients. So I've been talking a lot about empathy, but what is it? You know, what actually does it mean? What does it mean? What does it look like? And I thought I would show another video here where the speaker is actually Brené Brown. I think many people have probably heard of her through the grapevines of YouTube and online videos. But she's a researcher out of the University of Houston, I believe. And she did this great talk on the power of vulnerability and empathy. And I think this video really highlights her description of empathy as she's kind of seen it in her research. So I thought we could take a look at this.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with "at least." Yeah. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, "I don't even know what to say right now, I'm just so glad you told me." Because the truth is, rarely can a response make something better. What makes something better is connection.
So, from looking at this video, what I really gather is that, like Brené Brown said, empathy is just feeling with people. And it's doing 4 key things, right? So one of them is being able to take the perspective of the other person. So if you're with a patient, for example, and they're sharing either what's going on or a difficult situation, it's being able to take what they're saying and putting yourself in their shoes. And then I think the most important, in doing this is really staying out of judgment. So listening, trying to understand from their point of view, and doing it without judgment. And then the where our response comes as a provider is from really identifying what that person is experiencing, what's the emotion, and then being able to communicate it to that person so that they feel heard and understood. So we'll talk more about how to do this in practice, and then also show it in a video. But before going on into the communication skills and strategies, I do want to note that there are cultural differences that can impact communication and trust between a patient and provider. So for example, there can be language barriers that can come up depending on the patient that you're seeing. What you're trying to communicate to the patient or family may also not directly translate into the family's native language, especially if you're working with non-English speakers, as we do here in the US. The tone you use to communicate may also be perceived differently to families. The culture and country of origin may also impact the health literacy of the families that you're working with. And also, depending on where the family was coming from or where they got care previously, their experience with a medical provider may be different and may actually cloud the way they might start to work with you, right? And so that's when building trust with patients through communication and showing empathy becomes very important. So this is a bit of research. It's a little bit old, but I think it sends the message that that there are challenges that providers can experience when they work with families and patients who maybe don't speak the language, right? Don't speak English in our case here, although that may be different in other countries around the world. And what they have found actually when they look at patient-provider communication in these situations is that providers actually tend to communicate differently in such a way that they might actually be more directive with patients and families, right, when they're not necessarily English speaking or from a different background. And they may actually withhold more information. And the reason for that, at least that what was cited in the literature, is that they tend to be concerned that the family or patient will not understand. And so they're working from a belief that if they share certain information, they're not going to understand or get what they're trying to say. So they actually withhold more than being able to share more of the information. So some of the recommendations that are suggested when you're working with families from a different background or who don't speak the same language as you do as a provider would be to try to reduce the language barriers, either by having a provider who speaks the language, work with the family, or using a translator. As a provider, it's also important to check in with yourself. And I think this is an important skill regardless is to be able to be reflective, because from our own experiences and our own view of the world, sometimes we come in with our own biases and prejudices that may, and it could be about the culture, the language, or whatever the case may be, that may actually unintentionally impact the way we interact with families. And so I think that's also kind of an important piece, and I think that in and of itself could be its own presentation, but I think it's important to highlight. And of course, focusing on relationship building, right? And we do that through good communication. We do that through showing empathy and understanding with our patients. Okay, well, I want to do another pop quiz before we move on to the strategies, which I think most of us are probably excited to get to. So you can provide a response in the chat to what you think the response here is. So the question is, studies have shown that when the doctor is of the same race as the patient actually reports higher levels of trust and satisfaction. And we also see from the research that the visits last even longer by blank minutes on average. So what would you all think? Is it A, 10.2 seconds, B, 6.3 minutes, C, 2.2 minutes, or D, 1.5 minutes? And they're actually in minutes. I misspoke on the first one where I said it was 10.2 seconds. They're all in minutes. So if you had to guess, what would you think? A, B, C, or D? And I'll give you guys a few moments. If you want to type it in the chat box, you can. Okay. C. And the answer is C. That on average, these visits last 2.2 minutes longer. And I pose this question just to show that sometimes the cultural concordance between a patient and provider matters, but it's not everything, right? Because our communication skills can be enhanced to improve this patient trust and satisfaction that we know is associated with positive health outcomes for patients. Now, before jumping into the patient-provider communication skills, I do want to take a moment to show the medical procedural timeline for our Cleft patients that really starts from infancy and it goes into adolescence and even in the emerging adulthood years. So we see patients essentially grow up throughout their care. And I think it highlights the fact that throughout this entire process, there are multiple opportunities to communicate, to talk with the family, to get an understanding of their medical and procedural experiences, but also just about their care. So there's ample opportunities to be practicing some of these skills that we'll talk about. So our key communication skills, I'm going to talk about 6. There are definitely quite a few out there that are in the literature. So these are just some key ones that I'm going to highlight that I think provide just some concrete, actionable information, actionable steps. And so I'll go through each of them and then just talk about them in a little bit more detail. But if you're curious to learn more, I will have some links at the end of the presentation that you could access. And then also there's an article that a lot of this information I was able to pull from that lists just, I think, 9 or 10 of these communication skills. So I'm happy to send that along. So the first is, when engaging in a patient-provider encounter, it is important to try to assess what the patient already knows or what has been communicated to the patient. That way, as a provider, you can see what the patient understands and also what they don't understand, and then you can be filling in the gaps. So in my work as a psychologist as part of a craniofacial team, one of the things that I do when I come in and see patients is I typically come in after they've seen 3 or 4 providers already. And so in my own work with families to try to understand what they've received and, you know, how they're processing information. I might say something like, you know, you had a lot of appointments today with many different doctors. What did you hear, right? Or what did you take away from those visits? Other things that you might be able to ask are things like, you know, tell me about what you learned about your child's, and then fill in the blank, right? What's the condition? Or you might say something like, what did Dr. Jones tell you when she sent you here, right? When there's a reason for a referral. Or what have you made of your child's medical needs so far? Things like that. And the thing about these questions, as you probably have noted, is that they're very open-ended, right? We're not imposing any judgment or any preconceived notion of what the family's understanding is. And that's kind of the purpose of these questions, to really get a sense of what the family knows, and really will point you in the direction of what kind of information the family needs from you as a provider. So the second communication skill is to gauge what the patient wants to know or learn from your encounter. You know, I think as clinicians, and as many of you know out there, you know, as doctors, providers, we all have limited amount of time. And so by assessing what the patient wants to know, it can also help you shape your conversation and your visit with the family. So you might say something like, you know, what questions are you hoping we can answer today? And as a provider, you can also assess how much the patient wants to know by paying attention to the type of question that the patient is asking. So for example, when patients ask specific questions or clarifying questions, that might give you a sense of how much they understood. Sometimes patients may ask things that reflect confusion, and that might also give you, you know, a cue that maybe it's time to slow down and go back to just providing some basic information, right? And I think for me, at least when I'm working with families, if I'm working with a family that's very quiet and maybe stops talking, sometimes that cues me that maybe I need to pause and check in with the family, right? And be able to ask questions explicitly about, you know, how much of it did they understand. Or you can do one of the skills that we'll talk about in a couple slides, which is using a teach back, right? If you're having a sense that the family is maybe not understanding what you said, how do we do it in a way that is not perceived in a judgmental way for the family? It seems like it's open and it's collaborative. The third communication skill is to be empathetic, right, or have empathy. And like we saw in Brene Brown's video, there are 4 ways to do this, right? So the first one is to engage in active listening. So this is where you're practicing a lot of your nonverbal body language, right? So making good eye contact, you're nodding to indicate that you're understanding what the patient is saying, you're mirroring the patient's facial expressions, and you're also positioning your body in a way that's going to indicate that you're listening, right? And so I think those are key things to start to do to show empathy and to start listening. 2 is, you know, you're reflecting or summarizing what the patient's comments have been or what they're stating. So for example, you might say something like, so you were fine until this morning when you woke up with pain in your belly, and it's been growing more severe ever since, right? So you're just summarizing, and that also allows you to, you know, briefly be corrected if for some reason you know, it didn't clearly get communicated and you didn't grasp the whole thing. It gives you a chance to get corrected from the patient, right? Because they're hearing you say it back. 3 is you're identifying the emotion that the patient is feeling, and you're communicating that emotion to the patient. So for example, you might say something like, that must have been a pretty painful experience for you. You sounded like you were very sad. And then 4 is, it's always a good idea to check in, of course, with the patient to make sure that you understood correctly. So you might say something like, did I miss anything? Did I leave anything out? And so these 4 steps, essentially putting them together, is at the core of how we can practice being more empathic and showing more empathy in our patient care. Oops. Here we go. And then the 4th communication skill is simply to slow down. So slowing down allows for patients to understand new information. It allows patients to form questions that they might want to ask you, right? And I added this study finding here in this bullet point here that says that a study found that doctors wait only 23 seconds after a patient begins describing chief complaints before interrupting or redirecting. And I included it because I think it was a little bit surprising for me to hear, but it also just puts things into perspective, right? That we need to slow down and even allow time and space in between what you're communicating to be able to allow the patients to have an opportunity to respond, ask a question, clarify, things like that. And I know that sometimes we're also just pressed for time, so we want to quickly move through things. But I think the more we can do this, as we've seen in the earlier video on effective patient-provider communication, when we spend a few extra seconds doing this kind of communication, or showing empathy or slowing down, it actually has greater benefits and connection with the patient. So our time becomes more effective, right, in that interaction. So I guess the slowing down and allowing for some space, I should say, can be awkward, but also just very important. And it takes practice to get comfortable with it. The 5th communication skill is to tell the truth, right, and keep it simple. And what I mean by being truthful is just to communicate clearly without softening your language, because that can sometimes be misleading and not very clear to families. So for example, avoiding euphemisms is important. It's also important to be clear and simple with your explanation. So for example, instead of using things like fatigue, you could use something like feeling tired. Instead of using anterior and posterior, using the words front and back. So instead of using embolism, you would use words like blood clot. Or instead of using persistent, you could say it doesn't go away, or it's there all the time. Oh, and one more thing about this other slide is that it's important to remember that, even when we're communicating with families verbally, we really only retain a short amount of that information. So when it's possible, if you're communicating really critical information, being able to pair it with something that's written or something that's visual, so that you're able to capture their attention in multiple ways, I think it ends up being a little more effective. So keeping it simple, being truthful, and including multiple forms of the ways that you're communicating could be effective. And then the 6th communication skill is to use teach back. So this is the strategy I was mentioning a little bit earlier. And this is a teach back is a way that you can encourage the patient to ask questions. But also it's a way for you to be able to get a sense of how much the patient understood. And if for some reason the patient didn't understand, it gives them an opportunity, of course, to ask you to clarify or things like that. So you can use teachbacks to confirm information, and you might say something like, I want to make sure I explain things clearly. Can you tell me some of the side effects to watch out for with your medicine? And if the patient does not understand, you'll get a sense of it using a teachback question. And so I think that the biggest recommendation around teachbacks is, at least, when I've used it with families won't always clearly communicate back maybe what I've said, but when I get, when I don't get a response, or when I get silence, I might say something like, well, I think I need to do a better job of explaining. And then I might go in and try to explain it in a different way. Or I might actually say, maybe I should try explaining it in a different way. And so I often take the blame in that situation, or I take ownership over that mismatch in the communication if it wasn't very clear. So in other words, not blaming the patient. And then finally, of course, you want to encourage them to ask questions. This was one of those patient-provider communication aspects that patients rated as being pretty important, right? Is when they were encouraged to ask questions, or when they felt that they could ask questions. So encouraging that is important. Okay, so we've talked about these 6 key communication skills, and I've kind of given examples of them throughout. And the other thing I want to do is just show you a video of a provider who's essentially using some of these skills in this interaction. And for this particular video, it's not specific necessarily to a Cleft team care, but I think it highlights the relationship between a provider and then a parent of a young child. And so here in this video, the provider has a concern, and so it's going to bring it up to the patient's mother and then get a chance to talk about it. So we'll see some of those skills highlighted, and I'll try to pause it so that I could highlight what the provider has said in that moment.
Watch what happens this time when the provider cues in to what the parent is saying, empathizes with her situation, and attempts to work with the parent to find a solution that fits her needs.
So I wrote a prescription for antibiotics for Aiden. Okay. I did want to talk to you though. I'm a little bit concerned looking through his chart at how many ear infections he's had recently, and I noticed that you had checked the box that someone's smoking in the home. So I was wondering if you can tell me a little more about that.
Well, it's just me and him.
Okay, I'm going to stop it right there. And I'm curious if what you guys noticed about that opening statement that the provider used to start the discussion about smoking in the home. What were some of the key words that you heard? And if you want, you can type it in the chat box, and we could see what you noticed. But I think the thing that is key to take away from this video is that the provider uses an open-ended question, right? So she starts with her concern, then describes what she's seeing, and then she says, can you tell me about it, or tell me about it? So it becomes a very open-ended question, right? It's not imposing any judgment. It's really coming from a place of curiosity and trying to understand.
And I do smoke. I try really hard not to smoke around him, but I've been smoking for 10 years, except when I was pregnant with him. But it's so stressful being a single mom and having a full-time job, and so that's why I started smoking again.
You have a lot of things going on, and smoking's kind of a way to relax and de-stress.
Yes, yeah. Some people have a glass of wine, I have a cigarette.
Sure. And it sounds like you're trying not to smoke around him. Why'd you make?
And so I wanted to pause one more time in this video, because there's something really nice that the provider did in this situation as well, is that when the patient's mother talked about why she was smoking, what the provider did was use a summary statement. So when we talked about empathy, there was those 4 steps, right? There was the using active listening, which the provider is doing, right? Nodding, making eye contact. Her body language is open, right? She has her pen down, her clipboard is down, which is showing that you have my full attention. And then the provider is doing also summarizing back what the patient's mother is saying, right? So that's one of those 4 key things that you can do to show empathy, right? In addition to doing the active listening, you're reflecting back and summarizing. And then the other two things were, identifying the emotion and then communicating it to that. So what this provider did in this situation was essentially describe what the mom was experiencing. So she couched it under, you're feeling overwhelmed, right? And then I identified it and essentially reflected it back to the parent. And so what you can see in this situation is the parent again kind of nods and agrees with her to let her know that, yep, you got it. And this video, of course, is like 6 minutes long. And I think, what I can also do is if the audience is interested, we can send this link around so you can see the whole thing. But essentially what ends up happening in the rest of this video is the provider uses questions to get some more information from the parent, but also uses something that's called motivational interviewing that I don't know if people have heard of out there, but it's essentially skills that have been used to help patients move toward change, right? So if there's a specific skill, it's typically used in the substance abuse literature. When patients are wanting to change, what are the skills that as a provider, as a clinician, you can use to help elicit that change talk in the patient and provider and then helping them move toward a goal. So this provider essentially is doing that in the context of the visit to help the mom move toward acknowledging whether or not she wants to quit smoking. And so I think it just is a nice video that highlights a lot of the really good communication skills that we've talked about. So I think if you get a chance to see it or hear it, I think it would be quite beneficial. Okay, and then I just have 2 more slides to cover, and then we can open it up for questions. And the next few slides are really just around telehealth and communication. And I think this has become increasingly more important given everything that's going on in the world. Many of us are not, seeing patients in person. Maybe some of us are, or have a mixture of in-person and telehealth visits. And I think communication or being an effective communicator when you have telehealth or you have a screen in between you sometimes could make it more challenging, right? At least I have found that to be the case. So there are some really nice resources that I've tried to include in this PowerPoint here around how to connect over telehealth, right? And the tips to do that. Some of them, again, are similar to what we've talked about. So, they recommend being present, being able to identify what the patient's needs are up front. So saying something like, tell me what your main concerns are, what can I address at our visit today? Again, that's kind of going back to that key skill of, assess how much information the patient wants to know. Of course, listening, which is remaining quiet, allowing space for the patient to communicate and respond. And then, of course, empathy is a huge part. You could still be doing that over telehealth. And then finally, of course, sharing information. This next slide provides a little bit more information step by step about, how to communicate via telehealth. So it even gives you kind of the breakdown of, when you're greeting the patient, how to introduce yourself in the context of telehealth. And then, making sure that you're minimizing barriers to communication right off the bat, right? So if you're starting a visit, you might say something like, did you have any trouble getting on the call today? Can you see and hear me okay? Any adjustments I need to make so you can see and hear me better? I think those things up front when you're doing a telehealth visit could be really, really important. And then I know that we're all pressed for time, so doing things like, we have about 15 minutes together today, so I want to make sure we address what you are most concerned about, and tell me what they are. So doing those kinds of things up front are helpful. Again, there is a website here that highlights a few more telehealth communication resources that might be helpful. And again, other resources that I think might be helpful if this is a topic that you're interested in and want to just dive in deeper. And I think with that, we'll stop and open it up for some questions or comments. from people in the audience.
Thank you so much. That was really great, Dr. Ola. And I have to say, while people are thinking of any questions, I couldn't help but be reminded of the Maya Angelou quote while you were speaking. It's something about, at the end of the day, people may not remember what you said or did, but they'll remember how you made them feel. And you really touched so nicely on that, because as you said, it's obviously very important to get the clinical information across, but the way a patient and their family feels after they leave an appointment is equally as important. And so I really appreciated you touching, and it's a good reminder of that sentiment, as well as touching on telehealth. Obviously is a very relevant topic these days. So a lot of great tips there. And I love a Brene Brown video or teaching. So thanks for incorporating that too. Does anyone have any questions for Dr. Ola? Please feel free to add those into the Q&A section. I have a question also, if you don't mind. I was just wondering, based on your experience and your research from the 6 communication skills that you shared, is there one in particular that providers have a more difficult time incorporating? And if so, if you have thoughts on why that might be the case?
I think that's a good question. You know, I think in my experience, what ends up being the most challenging, and I guess maybe there's 2 of them, is really, you know, getting a sense of assessing what the patient understands first, because I don't think that's our natural tendency to do that as providers. I think we want to be able to provide information enough so that the family is able to make an informed decision about medical care, for example, or whatever the case may be. We're trying to teach a new skill that ends up being kind of the most common scenario in kind of my field of work. So I would say that that first communication skill, assessing what the patient already knows and how much information they want to receive, I don't think that that's necessarily taught for us to do, right? I think oftentimes we're meant to deliver information, and so I feel like that one ends up being hard. And then I think the other one I don't tend to see a whole lot is also the teach back. It's not a skill that we would automatically do. I think oftentimes we come back to doing things like, you know, do you have any questions? And so when we do something like that, it's a very close-ended question to a family, whether it's yes or no. Instead, we could be more open-ended and do things like, you know, what questions do you have? Or doing the teach backs, right? So I want to make sure that I understood this clearly, or I communicated this clearly. Can you tell me what were some of the things that I mentioned would be side effects, or what are some of the things that I mentioned you would want to look out for after the procedure? Things like that. So I would say those 3 are probably some that could be more challenging to incorporate.